All right, with me here on the telephone line, a good friend of mine, Dr. Weiss. He is here from CTENT, Sinus Center, actually. And Dr. Weiss, it's a pleasure to have you here. How you doing?
Good morning, Tony. Pleasure to be here. Thank you.
Oh, you're very, very welcome. Before we even get started, we want to thank you for your very generous contribution to the Habitat for Humanity program. Without guys like you, we wouldn't be able to do what we do. Thank you so much.
Oh, you're welcome. It's our pleasure. We've always been a big fan of that organization, and they just do great work.
They really do. They really do, helping people that need that little push, just right. A little push, and that's what it's all about.
That's what it is, yes.
All right. Now, we've got fall right around the corner, just a matter of days, and we're still seeing summer-like temperatures. What effect is that going to have on fall allergies for people?
Well, sometimes it has an effect, and sometimes it doesn't. Sometimes it can just sort of prolong the summer allergies. Obviously, we still have some of the grass allergy floating around out there, but ragweed has really, kicked into overdrive, and sometimes it can prolong that season until the first frost kind of thing. So we see a lot of that, but people get lulled into sort of a sense of security where, the temperature's nice, the weather's nice. The typical fall allergies may not happen, but it's happening. We're seeing it in the pollen counts, and if you're a sufferer, and particularly a ragweed fall type allergy sufferer, you should really be sort of taking precautions now and gearing up for it. So if you're not symptomatic yet, so we advise a lot of folks to start their nasal sprays, their antihistamines, their saline irrigations, all of that. When the leaves start to fall, we tend to see a lot more allergies because now we're kicking up a lot of the mold that may be in the ground, raking leaves and just the leaves kind of sitting on the ground. So a lot of our patients also suffer from mold allergy. So we kind of see a spike in the fall, and that's obviously just around the corner.
Now, the cooler weather is going to be here. Often this time of year, people are getting sick. How do you know if you have a sinus infection or a regular cold?
Yeah, that's we say that every day. This is what we call this is transition season. So we're going from basically an allergy-type environment from the summer and early fall into respiratory season. And respiratory season in some areas has already started. And when we say respiratory, we're talking about your viruses, your common cold. I mean, it's a little early for the flu, the actual flu, but there's a lot of flu-like viruses out there and a lot of common colds. And that's going to be kicking in very soon. The kids are back in school. They're starting to, share their organisms with each other, bring them home, and that's kind of how it starts. So this part of year, it's sort of transition season. And, yeah, we can look at a patient, and sometimes we're scratching our head. Is it an allergy? Is it a cold? Is it bacterial? Is it a sinusitis? And honestly, it's not always an easy thing to determine. Even when, we have all our technology and equipment to try to figure all that stuff out. So but I guess the bottom line is if you're not feeling well, probably a good idea to get evaluated and try to sort it out.
We're talking with Dr. Weiss from CTENT, Sinus Center. What are some of the treatments for those who suffer from chronic sinus infections? I mean, latest technology and all of that, those things that your team is using.
Yeah, no, it's a very exciting time to be, practicing my specialty at this point. I'd say the biggest breakthrough is the balloon dilation technology. And this has been around, going on close to 10 years at this point. And this is something that has largely replaced the need to have formal sinus surgery. So in the old days, if you had a chronic sinus infection, and this is defined as sinus symptoms that don't get better after 3 or 4 months, and you're actively treating them, but you're still having sinus headaches, you're still getting recurrent sinus infections where you always have to go back to the doctor and get antibiotics and another nasal spray. We can now, instead of doing surgery where you have to go under anesthesia and have a prolonged recovery and it's not very pleasant, a lot of these patients, and the vast majority now, we can use a balloon catheter and just dilate open a blocked sinus without really doing surgery. And most of these cases we do under local in an office setting. Recovery is very rapid, usually a day or two. And the full healing is a matter of weeks. And it's really a game changer in our specialty to be able to offer this to our patients because it's really, it doesn't endure the downtime on the patient's side of it that traditional surgery has done in the past. We also, the exciting thing that's really come out in the last couple of years also are these steroid implants that we can place into people's sinus cavities for folks that have really advanced sinus problems, nasal polyps, chronic inflammation, things like that. In the past, we really had a tough time battling those types of problems, but now the technology's been released that we can implant these little dissolvable devices that just sort of deliver the steroid directly to the tissue. So that's been really exciting. And also, the way we treat allergies these days has really, changed 180 degrees. In the past, if you had bad allergies, you would have to go for allergy shots, where you'd have to go to an office once a week, get an allergy shot, and you'd do this for a couple of years. It wasn't just a short thing. Today, a lot of our patients are treated using allergy drops, where you simply put a couple of drops under your tongue each day, and you get to do this at home. And it's really been shown to be very effective, and our patients have really benefited from all of these new developments.
Doc, unfortunately, we've run out of time. If people want more information, can they find a website? Can they call a number?
Yeah. It's ct-ent.com, and our phone number is 203-845-2244.
Sounds good. Dr. Weiss, I thank you so much for stopping by, and thank you so much once again for your contribution to Habitat for Humanity. We really appreciate it.
You're welcome, Tony. Thank you.
Thank you very, very much. Dr. Weiss, and he is from CTENT Sinus Center here on WACC 600.